We generally recommend what we call a full body skin exam. It may not be the first time, maybe you're coming for one little growth in your arm or wart on your foot. We're not gonna make you strip that day, but we're gonna recommend at some point you do that. We like to look all over in the body. When people come, I always say, here's my routine. I'm gonna look at your face, your eyelids, your ears, your nose, your scalp, then I'll go upper body, lower body, we'll look all over. If there's something in the private area, I'll ask you, can I look there? If you don't want me to, I get that. But we'll try to look all over. People have all sorts of concerns. They don't know what the names of things are. There are a lot of benign things that people get on their body, but it's good to know, hey, I see it, I'm not worried about it, this is what it is. Some people have unusual moles. If we look, there's an instrument that many of us are trained on called a dermatoscope. This is a special instrument that we can use to look at the skin and to identify moles that may need to be removed. More often than not, this is reassuring to me. By using this technology, I can see a mole different than with the naked eye. And again, more often than not, it will say, don't need to take it off. But if it looks atypical both with my naked eye and with the dermatoscope, then it will likely do a biopsy. Yeah, they don't take long. Those are usually booked for about 15 minutes. We'll of course talk, see if you have any concerns, then check your skin, really under 5 minutes. Again, I'll try to explain what each growth is, whether I think it's a concern or not a concern. If it's a small procedure, like a small biopsy, we'll probably do it the same day if that works for your schedule. We could always reschedule something if you have an event. If, however, it's something that would need a surgical procedure, we'll rebook that, and we'll usually book about a half an hour for those. When you come in, the site, we will do many things to ensure that we're getting the right site, that we check your medications. We always do what we call a timeout. That means we've identified who you are, your allergies, your medications, and then we'll make sure you're very comfortable, and then we will take care of you in the surgical suite.